today's presentation on left ventricular hypertrophy. Today we shall look at how to diagnose it using ECG as well as some echocardiographic changes that we may find in this condition. And so when we say left ventricular hypertrophy, we mean the thickening of the myocardium of the left ventricle of the heart. Or we can say the enlargement and thickening of the main pumping chamber of the heart. So what are the causes of left ventricular hypertrophy? Now, though left ventricular hypertrophy by itself is not a disease, it's usually a marker for diseases which involves the heart. And these diseases which can cause left ventricular hypertrophy include any condition which can increase the afterload, such as aortic stenosis, aortic insufficiency, and chronic hypertension. And chronic hypertension is the most common cause of left ventricular hypertrophy. In other words, what I'm trying to say is that any condition which causes the left ventricle to overwork itself can lead to the hypertrophy of the muscles of the left ventricle. So, apart from these conditions, we may also have some primary conditions of the heart, such as hypertrophic cardiomyopathy. And also, we must remember that long-standing mitral insufficiency can also cause or lead to left ventricular hypertrophy as a compensatory mechanism. So, let's look at how each of these cause these problems. Now, this is the normal heart function, and as we know, the blood enters through the superior inferior vena cava to the right side of the heart, then goes to the lungs and come back to the left side of the heart, and from the left ventricle passes through the aortic valves over here, then to the aorta and to the rest of circulation. Now, in aortic stenosis, as we can see on the right, we can see that the valve is stenosed, and so it cannot open well to allow blood flow from the left ventricle through the aorta to the rest of circulation. And so in aortic stenosis, what happens is that the stenosed valve or the narrowed valve restricts the flow of blood from the left ventricle to the aorta, and so there is always a greater amount of blood in the left ventricle which the myocardium must pump against, leading to hypertrophy of its muscles, as we can find over here. Now, in this diagram, which represents aortic valve insufficiency, what happens is that in this condition there is regurgitation of the blood which has been pumped by the left ventricle to the aorta. And so, because the aortic valve is loosed, it is weak, and so it cannot close completely to prevent the backflow of blood into the left ventricle. And so, during dilatation of the left ventricle, some amount of blood which has already entered the aorta comes back into the left ventricle, and so there is always an increased amount of blood in the left ventricle, of which the left ventricle must pump against. And so there is always increase in the pressure inside the chamber of the left ventricle, and so with time it leads to the hypertrophy of the muscles of the left ventricle. Now, in hypertrophic cardiomyopathy, what happens is that, as we learned in our previous tutorials, we know that this is a genetic disease of the heart muscles, which causes abnormal thickening. So as you can see, both the septum and the muscles of the heart are hypertrophied over here. And so what happens is that the heart, even though there is no presence of hypertension, has to pump harder in order to pump or in order to eject the blood from its chambers. And as you can see, there is even already very little chamber over here because of the hypertrophied muscles of the left ventricle. So this is how we get left ventricular hypertrophy. Sometimes also we may find left ventricular hypertrophy in athletes due to the intense and prolonged endurance and strength training that they go through. And so in this case, the heart adapts to the extra workload of the heart, leading to hypertrophy of its muscles. And so these are some basic ways through which the left ventricle gets hypertrophied. Now, let's quickly look at the diagnosis of left ventricular hypertrophy. Now, basically, the most accurate diagnostic tool that we use in this condition is the echocardiography, and so it's the gold standard. The echocardiography measures the thickness of the heart muscles. The normal thickness of the heart muscle is between 0.6 to 1.1 centimeters. Now, uh, any measurement which is more than 1.1 centimeter on echocardiography using the parasternal long axis and four chamber view will indicate left ventricular hypertrophy. We also have the short axis, view, which has three levels but is less sensitive. Now, when we look at the diagram on our right, what we find is that the left ventricle is hypertrophied as well as the septum. And so you can see that the chamber of the left ventricle is reduced. So all of these is showing hypertrophy of the left ventricle. On this diagram, you can also see very well that the chamber of the left ventricle is, markedly reduced due to hypertrophy of the walls of the left ventricle as well as the septum, as you can find over here. Now, in this echocardiography, what we find is significantly thickened left ventricular wall. Perhaps this is indicating a hypertrophic cardiomyopathy. And so, as you can see, we have the left ventricle over here. So this is the left ventricle, this is the chamber so much reduced, and you can see that the walls are hypertrophied, including the septum also hypertrophied, this being the mitral valve. And as you can see, if you compare the chamber size of the right ventricle and the left ventricle, you can see that there is huge difference in the chambers of these two areas of the heart. Now, when we look at this echocardiography, we find that there is normal left ventricular cavity with only a mild degree of left ventricular wall thickening. In fact, the whole echo over here, was fairly unremarkable, other than a mild left ventricular hypertrophy, as we can find over here. Okay. So that is it. So this being the right ventricle, you can see it's very much increased in size as compared to the left ventricle over here. So how do we use the ECG in the diagnosis of left ventricular hypertrophy? Now, the ECG will show signs of increased voltage, and so as the left ventricular wall becomes thicker, the QRS complex also becomes larger. Why? This is because the hypertrophy leads to increased muscular mass of the left ventricle, which generates larger spikes in the R wave on the precordialates. And the precordialate V5, V6 represents the left ventricle, and V1, V2 represents the right ventricle. And this is why we use the ECG as a screening test or a screening tool to determine who should undergo further testing with echocardiography. Now, there are a lot of ECG criteria which we use in the diagnosis of left ventricular hypertrophy, but I'm going to talk about just two of them over here. The first one being the so-called Sokolow-Lyon index, which is the sum of the length of the R wave in V5 or V6 and the S wave in V1 and V2, and it should be more than or equal to 35 millimeters or 3.5 centimeters, or when you count, you must get more than or equal to 7 large squares. And so we say R wave in V5, V6 plus S wave in V1, V2. So you choose the largest amongst them, and it must be more than 35 millimeters per mercury. When you measure and you get this recording, we say left ventricular hypertrophy is possible. Now, when we measure R wave in V1 or V2 plus S wave in V5 or V6, and we get a recording of more than or equal to 1.05 centimeters, then we say there is right ventricular hypertrophy. Now, when we look at the specificity and the sensitivity of the Sokolow-Lyon test, it has a specificity of 8.5% as well as a sensitivity of 20%. And like I said before, there are a lot of such criteria, but none of them is perfect. And so we try to combine, multiple, criteria, such that the sensitivity and the specificity will, go high. Now, when we look at the diagram on our right, what we find is the ECG showing the precordial in V5. So this was the largest. So I picked this one. So we are going to count. So we start from here. So this is 5, 10, 15, 20, 25, 26, 27, 28. So we are getting 28 boxes over here. We are getting, 28 boxes. So we are going to add this to what we find in V1. So V1 to we shall count, let's say here will be 5, 10, 15, 16, 17. So what do we get? So when we add V5 plus V1, what we are getting is 44 millimeters. So in V5 we had 28 millimeters, then in V1 we had 16 millimeters, and so when we add we are going to get 44 millimeters, which is more than 35 millimeters. Therefore, left ventricular hypertrophy is present according to the Sokolow-Lyon index. Now, in the next example, what do we find? We are going to measure using V5 or V6, and so over here we use the S in V1. S wave in V1 is equal to, let's count, 1, so 5, 10, 15, 20, 25. Or let's say it, so V1, 5, 10, 15, 20, 25. I think I made a mistake over here. So 25 plus R in V5. So R in V5 is giving us what? So we come here, then we count 5, 10, 15, 20, 25, 30, and you can say 31. So when we add 31 plus 25, what are we getting? We are getting 56. So this is more than 35 millimeters, and so we say left ventricular hypertrophy is present. Okay, so in this example, we are going to count the R wave in V6, and we start from here. We have 5, 10, 15, 20, 25, 30, 35, let's say 40. Then we are going to add it to the S wave in V1 or V2. So we can pick this one. So 5, 10, 15, 20, 25, 30. So what do we get? So R wave in V6 we got 40, S wave in V1 we got 27. So when we add it, we are getting 67 millimeters or 6.7 centimeters, and so we see left ventricular hypertrophy is present. Now there is an interesting feature of this ECG. When we look at the V6, what we find is that there is also ST segment depression, and anytime we find ST segment depression in left ventricular hypertrophy, what we say is that there is left ventricular strain, and so you find that the ST segment is depressed over here. Alongside, there is a very prominent R wave in V6. V6. You can find the same thing as well in V5. So we refer to this as left ventricular strain. Then in this example, what do we find? Wow. We are going to count the V6. So let's start. So 5, 10, 15, 20, 25, let's say 30. So we had 30 in V6. So let's count V1. How much are we getting? So 5, 10, 15, 20, 25, I think 30. So let's see. How much did we get? So we got R wave in V6 we got 30 millimeters, and S wave in V1 we got 30 millimeters. So we are getting 60 millimeters, which is more than 35 millimeters, and so we see left ventricular hypertrophy is present in this condition. And also on this one, let's do more. We are going to use, so over here you can see we can use either V5 or V6. So we can count. Let's start from here and count 5, 10, 15, 20, 25, 30. So over here, V5, we are getting 30. Let's go to V1. So we have 5, 10, 15, 20. So 20 plus 30, what are we getting? Okay, so I think we didn't do the counting well. So we used V5, R wave in V5, not in V6. Okay, R wave in V5, we got 25 millimeters, and S wave in V1, we got 20 millimeters. So we are getting 45 millimeters, which is more than 35 millimeters. And so we say there is left ventricular hypertrophy. I think we have another one. So yeah, over here, you can pause it and try and see if you can get the answer. So here we can use either V5 or V6 plus V1. So what do we get? So let's start 5, 10, 15, 20, 25, 30, 35. Then we are going to add it to V1. How much are we getting? 5, 10, 15, 20, 25, 30. So how much are we getting in all? So we had R wave in V5 was 35 plus S wave in V1 we got 30. So we are getting 65 millimeters, which is more than 35 millimeters. And so we say there is left ventricular hypertrophy using the Sokolow-Lyon index. Now let's look at the Kernel voltage criteria. With the Kernel voltage criteria, it has different values for both men and women, and so what we use is the R wave in AVL plus the S wave in V3, and in men it must be more than 28 millimeters or 2.8 centimeters, and in women when we measure we must get more than 20 millimeters or 2.0 centimeters. So with this criteria, there is an increase in specificity as well as sensitivity, and so this is much better as compared to the Sokolow-Lyon test. Just that this one is a bit difficult to remember, and so we frequently use the Sokolow-Lyon index. So like I said, this actually gives us a better prediction of left ventricular hypertrophy. Now when we look at this diagram, so we are going to count the R wave in AVL. So we can start from here: 5, 10, 15, 16, 17. Then we add it to the S wave in V3. So we start from here, we are getting 5, 10, 15. So how much do we get? So the R wave in AVL give us 17, and the S wave give us 15, which is equal to 32 millimeters or 3.2 centimeters, which is more than 2.8 centimeters in men as well as 2.0 centimeters in women. So we say there is left ventricular hypertrophy using the Kernel voltage criteria. Let's look at more examples. In this example, this was what we saw earlier on. So over here we are going to use the Kernel voltage, and so we are going to count the R wave in AVL, and how much are we getting? We have 5, 10, 15, 20. Then we add it to V3. How much are we getting? 5, 10, 15, 20, 25, 30. So, when we add R wave in AVL plus the S wave in V3, we are getting 47 millimeters, which is more than 2.8 or 28 millimeters. And so we say there is left ventricular hypertrophy. Then also in this example, let's count. This one is a bit blurred, but let's see. So we have 5, 10, 15, 20. Yeah. Then so this is AVL, and here is V3. So we have 5, 10, 15. So how much do we get? Yeah. Yeah, so R wave in AVL give us 16, and S wave in V3 is giving us 20. So in all, we are getting 36 millimeters, which points to left ventricular hypertrophy. I think I have another one. Okay, yes. So in this example, we are going to measure R wave in AVL. So we have uh, 5, 10, 15 plus V3. How much are we getting? 5, 10, 15, 20, 25, 30. So, we are getting 15 plus 40, which is 55 millimeters, which is more than the required number. And so we see there is left ventricular hypertrophy using the Kernel voltage criteria. Oh, I think I have one more. Okay, so we are going to use the AVL. So AVL plus V3. So let's count. We have 5, 10. Then let's count V3. We have 5, 10, 15, 20, 25. So 25 plus 10, we are getting 35. So actually we are getting 40. So R wave in AVL is giving us 10, and S wave in V3 is giving us 30, and so we get 40 millimeters, which is an indication that there is left ventricular hypertrophy. So these are some examples, or these are the basic ways by which we diagnose left ventricular hypertrophy. Now, because we said chronic hypertension is the common cause of left ventricular hypertrophy, our aim in treatment is prevention and control of high blood pressure. And so non-hypertensives must regularly check their blood pressure and seek medical advice. They must also exercise regularly, at least 30 minutes of moderate exercise every week. And so in a week we are getting about 150 minutes of exercise. Then also they must make sure that they eat healthy foods by avoiding saturated fat and salty foods, and also ensure that they eat more fruits and vegetables and avoid alcohol intake. Then also they must quit smoking, because as we learned earlier on, smoking is an independent risk factor for not only hypertension but a lot of diseases in our body. Then once the underlying cause such as aortic stenosis, aortic insufficiency, and hypertrophic cardiomyopathy, once all of them have been identified, then our management for such conditions should be done. And once we try to manage these underlying causes, then we shall find improvement in the left ventricular function. So thank you very much for your time, and don't forget to subscribe to Bright Medical Lecture. Bye bye.